smooth it.
We try to at least temporarily solve it so that it's not, so that you guys don't trip over it again. Again, good morning. My name is RK Whitehead. I'm president of Whitehead Die Casting. I've been the president, I guess now, for 22 years. I took over when my father passed away in 1990. And so, thank you. I wasn't going to walk that far, though. I was just going to avoid there. So anyway, so I've been running this business for 22 years and making the healthcare, the decisions about the healthcare benefits that we provide to our employees for that long. We've gone from, I think when I first started, we had about 70 employees, and we've been as high as 125, and now we're back down to 53. And we obviously are we're a cyclical manufacturer. We go up and down with the economy. We've bought conventional products. We were self-insured for 3 years because it made economic sense. And then when it stopped making economic sense, we went back to a conventional product, and I guess that was 7 or 8 years ago. So of our 53 W-2 employees, I think we've got about 38 of them are actually in our health plan. The others are either covered through spouse or, honestly, uninsured. And we have about 70 covered lives inside that plan. And one of the ways, and it's strictly an HMO. I mean, being in Gainesville, we don't have regional offices. All of my employees probably live within 30 miles of the plant. And so Northeast Georgia Medical Center is the primary provider. So we don't need a huge network to satisfy our healthcare requirements. One of the ways that we have managed our premium costs is migrating from a $500 deductible plan, and we did a $1,000 deductible plan. Now we're up to a $2,500 deductible plan. And I'm seeing that through my work with the hospital, a lot of bad debt and charity care. I mean, those numbers have gone up 50 and 60% in the past couple of years, as a lot of these type of high deductible plans have been put in place for employers in our area without the employers recognizing the hardship that maybe is putting on their employees, because as many businesses, we've got employees that are working paycheck to paycheck. I mean, our average pay rate is about $11 an hour, and you look at what that means across, working 2,000 hours a year. What's that, $23,000 a year? And where that falls into the PPACA or Obamacare, not exactly sure how all of our employee population, with that pool that puts us in with Obamacare. But anyway, what we've chosen to do, what I haven't heard a lot of other people talking about, is as an employer sort of assuming some of that risk back by increasing our deductibles and then self-insuring through some kind of health reimbursement account or something like that. Because I tell you, my employees can't afford a $2,500 deductible. I mean, some of y'all probably can't really afford all of a sudden $2,500 deductible. So what we've done is we have basically said, okay, employee, you're responsible for $200 of that deductible, and then I will reimburse you at 80% of whatever it costs you from $200 up to the $2,500. Same with copays. We've gone with a higher copay plan. We're doing, I think, a $45 office visit copay. You bring your little slip to us, and I'll give you $20 back. So the employee is still only seeing a $25 copay and a relatively low deductible, and yet I, as the employer, who have to pay for that health insurance to provide to them, am saving on the premium side. I'm willing to take some of that risk back so that I can, at least reduce my healthcare costs. Now the day may come where I'm out of options, and I think one of the things y'all need to understand is there are thousands of employers out there in the state of Georgia who don't understand what's going to happen in 2014. I mean, you got a staff of 25, I think you said, and if you want to know, you say, hey, go do some research, come tell me what I need to know, right?
Right.
Me, I've got the agents and some guys at the hospital I talk to understand it, but there are a lot of employers my size who have no idea what's going to happen. So, I don't know, is it, I thought that was Paul giving me the hook. So anyway, that's one of the things I think that as an industry y'all have to recognize is the guys that are out there like me that are trying to run their business day to day, who don't have a big staff to help negotiate and explain changes that are coming, are going to need some assistance and need some guidance and need some education around what this really means to their business. And at the end of the day, for folks like me, it's going to really come down to an economic decision of what can we afford to do. It's not what we want to do, not what we would like to do, not what we wish we could do, but what can we really afford to do. Because I'm competing against companies in China, and companies in Vietnam, and companies in Mexico. And so I have that cap of the price that I can charge for my product. And when 40% of my cost is labor, and probably another 12% is benefits on top of that, you know, I have to manage my benefit provision to be able to still make a fair profit and not price myself out of the market, and then nobody has a job. So that's the challenge that us small guys are going to have to take going forward. So that's it for now, right?
Thank you.